How to know whether what you are experiencing is true labor or you are just experiencing false contractions. Watch this full video to know 4 different ways in which you can identify whether you are experiencing true labor or false labor. Hi, I am Saranya. I'm the founder of Babypedia, a pregnancy coach and a life coach for mothers. So now first let us look at what is true labor and what is false labor. Well, true labor is when your contractions kickstart, your uterus is contracting occasionally, and your body is getting ready to deliver your baby. Now, false contractions is something that happens way before you go into true labor. Remember that a lot of women will experience false contractions, but some women will not experience false contractions. You will directly go into labor. So that is why it is important for you to watch this full video to know whether you are experiencing false labor or true labor. Also, if you know this, you will be able to identify if you are going into preterm labor. So if you are going into preterm labor, then you will have to rush to your doctor. Okay. So now, false labor is also called Braxton Hicks contractions. Because your uterus is a muscle, this is your uterus's way of practicing for the due date. So your muscle is contracting for multiple reasons. One is it is practicing. Two is in case your baby is not in the right position. These false contractions may be there to encourage your baby to get into the right position. But nobody knows the perfect reason or the right reason for why a lot of women get false labor or Braxton Hicks contractions. So now how do you differentiate between the two? We have to understand that true labor is usually always follows a pattern. Okay, so let's take the length of a contraction. You may start off with 20 seconds or 30 seconds or more, and then you will get a break, and then you will get another contraction. Now, as this keeps going on, the break in between, the interval in between the two contractions will usually be similar. So getting one contraction and then you have a break for 30 minutes and then you're getting another contraction and then you're getting another break for 20 minutes or so. Then this is a sign, it's very regular. It does not change even after you change positions, you take bath, you eat, or you're relaxing for some time. Then this is a sign of true labor. In case you are having a contraction now, and then you don't get a contraction for a couple of hours, and then you get another contraction, then you don't get another contraction for another few hours, and then you're getting another contraction, and the length varies. One is 5 seconds in length, another is 20 seconds in length, one is 1 minute in length. Then this is a sure shot sign that this is false labor. So if you suspect it is false labor, what you can do is drink some water, change your position. For example, if you've been walking around, lie down for some time. If you've been lying down or sitting, get up and walk around for some time. Take a bath. Go spend some time in water, splash some water on yourself, relax, maybe take a nap and get up, eat something. And when you do any of these, if your contractions stop, then it is false labor. But if it continues or it starts to progress or becomes, nearer to each other, then this is true labor. Okay, so what all should you note? You should notice whether the length of the contraction is the same. The gap or the interval between your contractions is also the same or it is reducing slowly. So you're having regular contractions, not random contractions here and there. Okay. And then you can do any of the activities that I mentioned before and see if your contractions stop or take a break. Then it is false contractions. If it continues whatever you do, then it is true labor. So once you get into a pattern, your contractions are going good. It's almost like the length of each contraction is 1 minute in length. Then you can pack your bags. You can take your bags that have already been packed. You should pack your bags usually by the 32nd or 33rd week. Take your hospital bags and leave for the hospital. You can inform your doctor, follow their instructions. So I hope you got clarity on how to differentiate between true labor and false labor. If you found this video useful, you learned a few new things, don't forget to hit the like button, share it with another pregnant couple, and subscribe to the Babypedia channel to get more information about trying to conceive, pregnancy, birth, breastfeeding, taking care of your newborn baby, early parenting, etc. I will see you soon in another interesting video. Till then, this is Saranya. Bye bye.